My experiences as a former child welfare caseworker in Pittsburgh, the director of a local children's advocacy center in Harrisburg, and an accreditation site reviewer for the National Children's Alliance have helped to shape my commitment to ensure children receive what they need to feel safe, cared for, and believed. I've also had the privilege of acting as co-chair of the CAPTA work group in Pennsylvania and observing firsthand the teamwork and perseverance necessary from state and local government, nonprofit agencies, and public-private partnerships to meet the requirements necessary to become compliant and eligible under CAPTA. Pennsylvania, as the 50th state to do so, submitted its application and state plan for CAPTA in spring of 2006. Professionals from child-serving agencies and disciplines across the state have been working diligently to meet the requirements and have selected several areas for improvement to Pennsylvania's child welfare response. Although our state is early in this process, great strides have been made that demonstrate the efforts of those committed to providing quality services to child victims and their non-offending family members. The Pennsylvania CAPTA work group has selected several areas for improvement. Among them, enhancing the Child Protective Services system by developing, improving, and implementing risk, safety, and developmental assessment tools, skill-based training for child welfare workers, state, public, and private agency staff is critical to ensure children at risk are identified and appropriate strategies and actions take place for their health, safety, and welfare. Developing and facilitating training protocols on mandated reporting target audiences that have regular and ongoing contact with children, such as primary medical providers, schools, hospital staff, and first responders. Collaborations among many child-serving agencies and community-based programs support comprehensive physical and behavioral health needs of children who are reported to be abused. These are among just a few of the initiatives in progress as Pennsylvania carries out CAPTA requirements for compliance, and CAPTA funding has allowed Pennsylvania the opportunity to move forward with the establishment and training of citizen review panels to provide recommendations for systemic change of the Child Protective Services system. Training of healthcare providers to report drug-affected infants has increased. The opportunities to engage families that might have remained invisible in the system, thereby improving outcomes for those that are addicted as well as their children. I've conducted more than 70 accreditation site visits of children's advocacy centers across the country over the past 7 years. I've met many dedicated professionals, community members, and staff members from public and private agencies who are charged with providing services to child abuse victims and their non-offending family members. Many centers utilize federal funding for child abuse prevention and treatment programs to reach underserved populations and develop public-private partnerships to provide services in creative ways. CAPTA compliance has allowed Pennsylvania to examine its current child welfare system and develop improvements for the benefit of children and families. In addition to child abuse prevention and awareness efforts, CAPTA compliance will also allow Pennsylvania to increase its impact on providing a coordinated response to child abuse across the state through access to funding from the Criminal Justice Act. The Children's Advocacy Center, or CAC model, is a collaborative community response that coordinates multidisciplinary partners in the investigative, evaluation, and treatment of child victims of abuse. Thousands of child abuse victims in Pennsylvania have benefited from the collaborative team approach for child interviews, medical exams, and mental health treatment. CJA funding will be a welcome resource to assist those communities in developing effective child abuse multidisciplinary teams. The Pinnacle Health Children's Resource Center, as an accredited CAC, has served a geographic region of more than 20 counties for many years. In 2008, the Children's Resource Center evaluated 883 children from many counties in central Pennsylvania. Approximately 52% are referred for services from Dauphin County, a third-class county. The CRC has seen an increase this year in the numbers of children referred for both sexual and physical abuse, and an increase in requests to interview siblings of children that have died. Dauphin County has seen a 12.8% increase in the numbers of indicated cases of child abuse thus far this year. In 2008, there were 4 reported deaths in Dauphin County. In the first 10 months of this year, there have already been 10 child deaths. Prior to 2009, Pennsylvania did not keep statistics of child near deaths, but has kept them this year in compliance with CAPTA. In Dauphin County alone, there have been 8 near fatalities of children, 4 which were indicated cases of abuse. The increase in numbers of reported abuse cases and the severity of this abuse inflicted is evident in this community. CAPTA and CJA provide support for local programs and is essential to continuing the comprehensive quality services provided to child abuse victims in Pennsylvania and throughout the United States. Child abuse prevention efforts, as well as coordinated interventions, are imperative to providing a safe environment for children, families, and the communities in which they live. And I welcome any questions you may have.